Hello guys, this is Indian Medico and this video is a review of radiology for medical students. First let us see radiological images of neck and thorax. Let us mark the structures here. This is a lateral x-ray of neck. A is trachea, B is thyroid cartilage, C is hyoid bone, D is epiglottis, E is tongue, F is posterior arch of C1 vertebra, G is hard palate. If you see this lateral x-ray of neck, you can see thumb sign. This is seen in acute epiglottitis. Now let us mark the structures in this PA view of chest. A is mediastinum, B is right diaphragm, C is C is costophrenic angle, D is clavicle, E is right pulmonary artery, F is right atrium, and G is left ventricle. This X-ray shows foreign body in trachea. Foreign body in trachea. Now let us mark the structures in this X-ray. This is a lateral view of chest. A is retrosternal clear space, B is inferior vena cava, C is left ventricle, D is left hemidiaphragm, E is posterior costophrenic angle, F is trachea, G is right pulmonary artery. This is again a lateral view of chest. If you notice, you can see fluid with meniscus in the posterior costophrenic angle. This is a case of pleural effusion. Now let us mark the structures in this CT scan. A is esophagus, B is trachea, C is superior vena cava, D is brachiocephalic artery, E is left common carotid artery, F is aortic arch, G is thoracic spinal cord. What does this X-ray show? This X-ray shows normal thymic shadow. Now let us mark the structures in this PA view. A is stomach bubble, B is left main pulmonary artery. C is aortopulmonary window. D is trachea. E is first rib. F is coracoid process of scapula. And G is aortic arch. This PA view shows right upper lobe consolidation. This is probably a case of bacterial pneumonia. And let us mark the structures in the CT scan. A is descending aorta. B is azygous vein. C is left atrium. D is esophagus. E is aortic root. F is right atrium. And G is right ventricle. Now this CT scan shows calcification in coronary artery. Calcification in coronary arteries. Now let us mark the structures in this CT angiogram. A is ascending aorta. B is brachiocephalic trunk. C is left common carotid artery. D is left subclavian artery. In this case there is a stent. E is left main pulmonary artery. F is left atrium. G is left lower lobe pulmonary veins. What does this CT angiogram show? It shows multiple filling defects. So this is a large pulmonary embolism at bifurcation of pulmonary artery. What does this X-ray show? This is a normal PA view chest X-ray. This is a normal lateral view chest X-ray. This picture shows a left superior mediastinal mass. This is a CT scan showing thyroid mass. Okay, in this PA view, you can see the right diaphragm is elevated. The right diaphragm is elevated. So it may be right lower lobe volume loss. This shows right pleural effusion. This is a CT of right pleural effusion. Now, This chest X-ray shows deep sulcus sign. This is known as deep sulcus sign. This is seen in case of pneumothorax. So this is a case of left pneumothorax. Also there is right hemothorax. This shows right hemothorax and left pneumothorax. Now what does this chest X-ray show? There is right sided apical pneumothorax. There is also pleural effusion. In this case, the visceral pleura is visible. So this is also a case of pneumothorax. This is a case of COPD. Now let us see about the radiological features of COPD. There will be pulmonary overaeration, that is, the lungs are dark looking as you can see in this picture. The AP diameter will be increased. The intercostal spaces will be widened and the hemidiaphragms will be flattened. So all these features can be seen. So this is a case of COPD. This picture shows left upper lobe pneumonia. This picture shows interstitial pneumonia. This is a close-up view of interstitial pneumonia. Now this picture shows congestive heart failure. In case of congestive heart failure, the cardiothoracic ratio will be greater than or equal to 0.5. There is interstitial pulmonary edema and bilateral pleural effusion in this case. So it is a case of congestive heart failure. This picture shows bacterial pneumonia. In case of bacterial pneumonia, there is alveolar opacity and it is confined to a lobe as you can see in this picture. This is viral pneumonia. As you can see, in viral pneumonia there is interstitial pneumonia. This CT scan shows lung cancer. Now let us see radiological images of abdomen. Let us mark the structures in this CT scan. A is right lobe of liver. B is spleen. C is left kidney. D is right adrenal gland. E is splenic vein. F is pancreas and G is stomach. What does this picture show? This picture shows left adrenal adenoma. Now let us mark the structures in the CT scan. A is left kidney. B is right renal artery. C is gallbladder. D is stomach. E is duodenum. F is small bowel. and G is inferior vena cava. Now let us mark the structures in this CT. A is stomach, B is spleen, C is tail of pancreas, D is aorta, E is inferior vena cava, F is portal vein, and G is right adrenal gland. Now what does this CT scan show? It shows hepatic metastasis. Now let us mark the structures in this CT. What is A? A shows surgical clips from cholecystectomy. These are basically surgical clips after cholecystectomy. B is left lobe of liver. C is spleen. D is pancreas. E denotes splenic vein. F, as discussed earlier, is inferior vena cava, and G is left renal vein. Okay, now let us mark the structures in this CT. A is cecum, B is terminal small bowel, C is appendix, D is psoas muscle, and E is descending colon. Coming to this image, what is A? A denotes rectum, B is uterus, C is urinary bladder, D is right common iliac vein, E is left common iliac artery, F is sacrum, and G is rectus abdominis muscle. Now let us mark the structures in this X-ray. What is A? A is liver, B is pre-peritoneal fat strip, C is psoas muscle, D is right kidney, and E is splenic flexure of colon. Now let us mark the structures in this X-ray. A is liver, B is splenic flexure of colon. What is C? As discussed earlier, C is a right costophrenic angle. D is left iliac crest. What does this CT scan show? This CT scan shows abdominal aortic aneurysm. Abdominal aortic aneurysm. What does this X-ray show? This X-ray shows hepatomegaly. What does this X-ray show? This X-ray shows paralytic ileus. As you can see, there is generalized distension of small and large bowel. There is distension, and there are multiple air fluid levels. So this is a case of paralytic ileus of colon. This X-ray shows small bowel obstruction. As you can see, the air distance the bowel greater than or equal to 3 centimeter, and there are asynchronous air fluid leveling. That is, there is stair step pattern. So this is a case of small bowel obstruction. This is a CT scan showing multiple air fluid levels. This is a case of small bowel obstruction. Now what does this picture show? This picture shows pneumoperitoneum. Again, in this case, you can see free air anterior to the liver. So this is a case of pneumoperitoneum. Now this CT shows acute necrotizing pancreatitis. This part shows non-enhancing parts of head, neck and body of pancreas, and this shows normal enhancing tail. So this is a case of acute necrotizing pancreatitis showing non-enhancing head, neck and body of pancreas. This is ultrasound of cholelithiasis, that is gallstones. As you can see, these are the gallstones. This is the posterior shadowing, and this is the wall thickening. Now let us see about radiological images of gastrointestinal system. This picture shows a normal esophagogram, that is barium swallow. Barium swallow. This is actually a oblique view. This shows a normal barium swallow AP view. This shows normal air contrast of upper gastrointestinal system. This shows normal small bowel barium follow through. Again, this is a normal small bowel. This is normal air contrast barium enema. You can visualize the colon. Now this picture shows CT of sigmoid diverticulosis. See, diverticulae are pockets of colonic mucosa and submucosa. Through weakness of muscle layers in colon wall, they appear like this on CT. This picture shows normal HIDA scan. HIDA scan is also known as chorescintigraphy. We use technetium 99 tracer for taking HIDA scan. It is used to visualize bile ducts, liver, gallbladder. This shows the common bile duct. Now let us see radiological images of urinary system. This is a normal intravenous pyelogram. This is a normal coronal CT of kidneys. This shows left ureteral obstruction. This is an ultrasound of renal obstruction leading to hydronephrosis. This is the renal parenchyma, and these are the dilated renal pelvis. This is again an ultrasound of renal cyst. This picture shows CT of simple renal cyst of left kidney. This is normal adrenal gland. This shows left adrenal nodule. Now let us see radiological images of musculoskeletal system. Now let us mark the structures in this X-ray. A is greater trochanter of femur. B is obturator foramen. C is acetabulum. D is sacroiliac joint. E is symphysis pubis. F is femoral neck. What does this picture show? This picture shows femoral neck fracture. And let us mark the structures in this MRI. A is quadriceps tendon. B is patellar tendon. C is anterior cruciate ligament. D is posterior cruciate ligament. E is femur, and F is tibia. G is patella. This MRI shows anterior cruciate ligament disruption of anterior cruciate ligament, and there is a large effusion. Now let us mark the structures in this X-ray. What is A? A is acromioclavicular joint. B is coracoid process. C is acromion process. D is greater tuberosity of humerus. E is glenoid. F is scapula, and G is head of humerus. Okay, this X-ray shows minimally displaced transverse fracture through anatomical neck of right humerus. It is a minimally displaced transverse fracture of anatomical neck of right humerus. Now let us mark the structures in this MRI. What is A? A is femoral head. B is acetabulum. C is greater trochanter. D is urinary bladder. E is uterus. F is right ovary. And G is psoas muscle. Now, what is this MRI show? This MRI shows avascular necrosis of right femoral head. Now, let us mark the structures in this X-ray. A is scaphoid. B is lunate. This bone is triquetral. C is pisiform. You know the mnemonic, right? She looks too pretty, try to catch her. This is she looks too pretty. Now coming to try to catch her, this is trapezium. Trapezoid. E is capitate. And D is hamate. So this completes the carpal bones. Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate and hamate. This picture shows distal radius fracture. This is a Colles fracture. Now let us mark the structures in this X-ray. A shows the growth plate in the proximal fifth metatarsal. B is cuboid. C is navicular. D is medial cuneiform. And E is a sesamoid bone. This picture shows fracture of medial malleolus. The black arrow, this one, this is the fracture line and this is the growth plate. This belongs to Salter-Harris type 3. We will be seeing about Salter-Harris classification in detail. Now what does this picture show? This shows humeral head fracture dislocation. This is the same thing after reduction. This X-ray shows anterior subcoracoid shoulder dislocation. This again is anterior dislocation, but this view is known as scapular Y view. Scapular Y view. This X-ray shows osteoarthritis. It is basically a degenerative disease. Osteoarthritis of left knee. As you can see, the joint space is reduced in this case. This is again case of osteoarthritis. In this case you can see degenerative osteophytes, which are para-articular new bone in medial femur and tibia. These are the various fracture patterns. This is a transverse fracture, this is a linear fracture, this is oblique non-displaced fracture, this is oblique displaced fracture, this is a spiral fracture, this is a green stick fracture, and this is a comminuted fracture. Now let us discuss Salter-Harris classification. Salter is a mnemonic. In type 1, there is separated growth plate. In type 2, the fracture is above the growth plate, that is, it is in the metaphysis, and this is the most common of Salter-Harris fractures. In type 3, the fracture is below the growth plate, that is epiphyseal fracture. So in the X-ray which we saw earlier, the fracture line was in the epiphyseal region. So it is Salter-Harris type 3. Salter-Harris type 4 is through the growth plate, that is, it involves both epiphysis and metaphysis. Salter-Harris type 5 is ER, that is erasure of growth plate, that is, there is compression in this type. Now let us see about the distribution of bone tumors. This is the physis or growth plate. So below the growth plate, this is the epiphysis, this is the metaphysis, and this is the diaphysis. Now, the tumors common in the epiphyseal region are chondroblastoma and giant cell tumor. Giant cell tumors can also occur in the metaphysis, as you can see here. The tumors common in the metaphyseal region are enchondroma, non-ossifying fibroma, and chondromyxoid fibroma. As you can see, non-ossifying fibroma and chondromyxoid fibroma can occur in the diaphysis also. The tumors that occur in diaphysis are solitary bone cyst, fibrous dysplasia, and Ewing sarcoma. So these are the important tumor locations that you must remember. This is an MRI which shows effusion of suprapatellar bursa. Now this is a lateral cervical spine X-ray. This shows the 3 arcs. These 3 arcs are helpful to find out normal alignment. This is a normal lateral cervical spine X-ray. This picture shows lumbar spine oblique view. This dog-like appearance is called Scotty dog. The shape is created by the articular processes which form the leg. The pedicle forms the eye, and the neck is formed by pars interarticularis. This is Scotty dog appearance seen in X-rays of lumbar spine oblique view. Now let us see about radiology of head and neck and neuroradiology. Let us mark the structures in this skull X-ray. A is hard palate, B is soft palate, C is frontal sinus, D is sella turcica, E is coronal suture, F is external occipital protuberance, G is anterior arch of C1. This X-ray shows a parietal skull fracture. Now let us mark the structures in the CT scan. A is mandible, B is alveolar ridge, C is maxillary sinus, D is zygoma, E is orbital floor, F is inferior turbinate, G is optic nerve. What does this CT scan show? This CT scan shows blowout fracture of left orbit. This is a blowout fracture of left orbit. Now let us mark the structures in this CT brain. A is fourth ventricle, B is tentorium, C is basilar artery, D is Sylvian fissure cistern, E is falx cerebri, F is optic chiasm, and G is sigmoid sinus. Now let us mark the structures in this CT. A is external occipital protuberance, B is cerebellum, vermion of cerebellum, C is quadrigeminal plate cistern, D is third ventricle, E is anterior horn of lateral ventricle. F is head of caudate nucleus. And G is septum pellucidum. Now, this CT scan shows right occipital epidural hemorrhage. As you can notice, it has a lens shape. Now let us see about the color of hemorrhage in CT scan. In case of acute hemorrhage, that is less than 3 days, the color will be white. In case of subacute hemorrhage, that is between 3 days to less than 3 weeks, the color will be grey. And in case of chronic hemorrhage or chronic hematoma, that is greater than 3 weeks, it will be hypodense. Just to revise, acute hemorrhage will be white in color, subacute hemorrhage will be grey in color or isodense, and chronic hemorrhage will be hypodense. Now let us mark the structures in this CT scan. A is superior cerebellar cistern, B is fourth ventricle, C is basilar artery, D is internal carotid artery, E is middle cerebral artery, F is temporal horn of lateral ventricle, G is mastoid hair cells. Now, what does this CT show? If you notice, there is right middle cerebral artery aneurysm. Now, let us mark the structures in this CT scan. A is superior cerebellar cistern. B is anterior horn of lateral ventricle. C is posterior limb of internal capsule. D is septum pellucidum. E is frontal cortex. And F is head of caudate nucleus. Now, this picture shows left subdural hematoma. As you can notice, the shape is semilunar or crescentric in shape, and there is left to right midline shift. Now, let us discuss the structures in this MRI. A is cervical spinal cord. B is tentorium. C is third ventricle. D is choroid plexus of lateral ventricle. E is superior sagittal sinus. F is Sylvian fissure. And G is mastoid hair cells. This is a coronal MRI with gadolinium showing large right temporal meningioma. I repeat, this is a case of large right temporal meningioma. And the investigation is MRI with gadolinium. Now let us discuss the structures in this MRI. A is thalamus. B is atrium of lateral ventricle. C is choroid plexus. D is Sylvian fissure. E is basal ganglia. F is frontal lobe. And G is frontal sinus. Now, this investigation is flare sequence MRI. Flare is fluid attenuated inversion recovery MRI. This case shows multiple sclerosis. I repeat, this is a case of multiple sclerosis, and the investigation is flare sequence MRI. Now let us discuss the structures in this MRI. A is splenium of corpus callosum. B is third ventricle. C is putamen and globus pallidus. D is anterior horn of lateral ventricle. E is genu of internal capsule. F is head of caudate nucleus. And G is frontal sinus. Now what does this MRI show? This MRI shows ischemic infarction in right mid-parietal lobe. You can notice degenerative white matter also. This is a case of ischemic infarction. Now what does this CT scan show? If you notice, there is nasal bone fracture. This CT we have discussed earlier. This is orbital blowout fracture. This is a normal malar bone. It resembles an elephant. The trunk of this elephant, that is this part, is formed by zygomatic arch. I repeat, this is a normal malar bone. This is normal CT head. This is ischemic infarction as seen in CT. If you notice, it is wedge shaped, and in case of ischemic infarction, there is a small amount of mass effect that resolves after 7 to 10 days, and there will be grey and white matter edema. This is MRI of ischemic infarction. As discussed earlier, it is wedge shaped, and there will be grey and white matter edema, and there will be small amount of mass effect that resolves after 7 to 10 days. Now, this is a CT scan of brain tumor. This is a tumor. This is a tumor. In case of brain tumor, it will be round or oval in shape. The edema will be confined to white matter. All these arrows show white matter edema. Notice these are all white matter edema. This one and this one. This is a grey matter. In case of brain tumor, there is no grey matter edema. I repeat, a brain tumor is round or oval. The edema is confined only to white matter, and there will be a mass effect that persists over time. This is how you differentiate between ischemic infarction and brain tumor. This picture shows old ischemic infarction. This picture shows a hemorrhage which is crescent or semilunar shape. We have discussed this earlier. If it is crescent shape, it is subdural hemorrhage, and this is isodense, so it is subacute subdural hemorrhage. This shows both the hemorrhages. This is a epidural hemorrhage. It is lens shaped. This is a subdural hemorrhage which is semilunar shaped. What does this show? This shows extradural hemorrhage, and the color is white, so it is acute extradural hemorrhage. This shows extradural hemorrhage. The color is hypodense, so it is chronic extradural hemorrhage. This picture shows intraparenchymal hemorrhage. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.